I'd like to call this meeting of the House Insurance Committee to order. Alia, please take the roll.
Chair Kim,
Here.
Rep. Apney, Brennan, Cephas, Gergley,
Designation.
Haddock,
Designation.
Kozarowski,
Designation.
Malagari, Mursky, Monroe,
Designation.
Parker, Scott,
Designation.
Venkat, Warren,
Designation.
Chair Pickett,
Here.
Fink, Fritz, Kutz, Ledbetter, Nelson, Mahalik,
Who's our designation? Designation?
Miller, Rowe, Zimmerman.
Designation.
Thank you, Alia. We have a quorum. The first order of business is consideration of House Bill 1021. Ellen, please explain the bill.
House Bill 1021 is a freestanding bill that prohibits life insurers from discriminating against an applicant solely for obtaining an opioid reversal agent such as naloxone. The insurer may not do the following: deny or cancel life insurance coverage, limit the amount of coverage, charge a different rate from other applicants.
Thank you. We have the prime sponsors of the bill, Representatives Sanchez and Curry, here with us today. At this time, I'd like to invite them to say a few words.
Thank you, Chairwoman Kim, and good morning to everyone. Happy Monday. I just have a small statement that Representative Sanchez and I put together around this important bill. This bill, Lloyd's Law, also known as House Bill 1021, addresses the issue of discrimination faced by individuals who possess Narcan or naloxone, a medication used to reverse opioid overdoses in their prescription profiles. The bill is named after Lloyd, the son of my constituent, Sharon White, who tragically lost his battle with addiction despite his extraordinary efforts to stay well, and with Narcan or naloxone to potentially save his life. Sharon White's experience, along with her daughters Anna and Stephanie, highlights the discrimination faced by individuals like her who have Narcan in their prescription profiles. Despite Sharon's efforts to obtain this important drug to potentially save her son's life, she was denied life insurance coverage simply because of the presence of this drug in her prescription profile. This discrimination is unjust and discourages individuals from obtaining this drug and other life-saving medications, thereby putting more Pennsylvanians at risk. Lloyd's Law aims to prohibit insurers from denying coverage to individuals solely because they possess naloxone or Narcan in their prescription profiles. By addressing this issue, this bill seeks to support the friends and families of those in the recovery community, and to end the stigma and discrimination surrounding substance use disorders. Overall, this bill, Lloyd's Law, is a step towards combating the opioid epidemic and ensuring that individuals have access to life-saving medications as they continue to stay well or try to stay well without facing the unjust discrimination from insurers. Thank you, everyone, for hearing this statement, and Representative Sanchez and myself, we urge you for a yes vote. Thank you.
Thank you, Representative Curry and Sanchez. There is one amendment to the bill. Representative Pickett offers Amendment A04256. I second this agreed to amendment. Alan, please explain the amendment.
A04256 clarifies renewals are also included in the anti-discrimination language. The amendment also defines insurer as a life insurer.
Thank you. Any comments, Madam Chair?
And thank you, Madam Chair. This is an agreed to amendment, so I do ask for an affirmative vote. Thank you.
Is there any discussion on the amendment? Are there any negative votes on the amendment? Hearing none, Amendment A0495 is amended into the bill. I move to report House Bill 1021 as committed. Is there a second? Representative Venkat. Any comments? Madam Chair.
Thank you again, Madam Chair. The opioid epidemic continues to have a great impact across the Commonwealth. This bill will ensure that life insurance applicants are not discriminated against because they obtained a prescription for medication like naloxone to save a life. Thank you.
Is there any discussion of the bill? Are there any negative votes on the bill? Hearing none, House Bill 1021 is reported from the House Insurance Committee unanimously. Thank you. Good job and congratulations, Representative Sanchez. and
Thank you
Curry.
very much.
Absolutely. The next order of business is consideration of House Bill 1867. Is there a second? Representative Venkat. Alan, please explain the bill.
House Bill 1867 amends Title 40 insurance and requires health insurers to provide health insurers to provide healthcare providers with multiple payment methods, not only virtual credit cards, and to notify providers of fees imposed by the insurer or its contractor may apply to electronic payments. Consent must be obtained from the provider who filed claims before collecting such a fee, and clear instruction for choosing another payment option must be available.
Thank you, Alan. Now, there is one amendment to the bill. Representative Venkat offers Amendment A04095. Is there a second? Representative Brennan. Alan, please explain the amendment.
A04095 provides a uniform standard for electronic payments, deletes provisions regarding the healthcare billing agent, defines merchant servicer, clarifies that health insurer and their contracted vendors do not need to notify healthcare providers of merchant servicer fees, and clarifies the bill does not apply to dentists and dental insurers.
Thank you. Any comments, Madam Chair?
And thank you, Madam Chair. This is an agreed-to amendment. I do ask for an affirmative vote. Thank you.
Thank you. Is there any discussion on the amendment? Are there any negative votes on the amendment? Hearing none. Oh, I lost my place. Excuse me. We have to move to report the House Bill 1867, right? Okay. Hearing none, amendment is amended onto the bill. I move to report House Bill 1867 as amended. Is there a second? Representative Parker. Representative Venkat, any comments?
Sure. Thank you, Chair Kim, Chair Pickett, and staff of the committee. I brought forward this legislation based on an article that was published that spoke about the fees that are associated with virtual credit cards and their use in payment for in-network providers from health insurers. I think we can all agree that our healthcare reimbursement system is very complex, and that one of the goals we should have is to have as much transparency and cost effectiveness in this process as possible. This legislation will allow healthcare providers in partnership with health insurers to choose what is the best method available for receiving payment for services rendered for patients. And so I would urge an affirmative vote so that we can try and develop more transparency and options within the healthcare insurance reimbursement system.
Thank you. Is there any discussion on this bill? Madam Chair.
Thank you, Madam Chair. We did pass a similar bill a few weeks ago pertaining to dental claims. I do not have concerns with this bill, and I do ask for an affirmative vote. Thank you.
Thank you. Any negative votes on this bill? Hearing none, House Bill 1867 is reported from the House Insurance Committee unanimously. Thank you. Now, the next order of business is consideration of House Bill 2138. Is there a second? Representative Abney, thank you. Alan, please explain the bill.
House Bill 2138 amends the insurance company law to require health insurance policies to cover blood pressure monitors for pregnant or postpartum insureds. At a minimum, coverage shall include reimbursement for one blood pressure monitor for each pregnancy.
Now, there is one amendment to the bill. Chair Pickett offers Amendment A03992. I second the amendment. The amendment is agreed to. Alan, please explain the amendment.
A03992 adds the words medically necessary so that a blood pressure cuff is covered by insurers when medically necessary.
Madam Chair.
And thank you, Madam Chair. Stakeholders have asked for the medically necessary clarification. I do support that, and I ask for an affirmative vote. Thank you.
Thank you. Is there any discussion on the amendment? Are there any negative votes on the amendment? Hearing none, Amendment A03992 is amended into the bill. I move to report House Bill 2138 as amended. Is there a second? Representative Cephas, is there any discussion of the bill? Representative Cephas.
Thank you, Madam Chair, and I want to thank the Insurance Committee for considering House Bill 2138, and I would also like to thank Representative Steele for her advocacy and work with stakeholders from the field to address the rising issues of hypertension in our mothers and their babies. As you know, I am one of the tri-chairs of the Black Maternal Health Caucus, which is a caucus laser-focused on improving and reversing the rate of maternal mortality and morbidity in the Commonwealth of Pennsylvania, and addressing the issue of hypertension through blood pressure cuffs is a critical issue. As we know, Pennsylvania is no stranger to the national crisis of maternal morbidity, and with the most recent Maternal Mortality Review Committee report, Pennsylvania residents experienced a pregnancy-associated mortality ratio of 83 deaths per 100,000 live births, with large disparities identified. In total, in 2020, 107 individuals lost their lives during pregnancy, delivery, or up to 1 year postpartum. And at the heart of this crisis lies a fundamental truth. Access to quality health care is not a privilege, but a basic human right. And one of the crucial aspects of maternal health care that often goes overlooked is the monitoring of blood pressure during pregnancy and childbirth. Elevated blood pressure, if left unchecked, can lead to serious complications such as preeclampsia and eclampsia, which are significant contributions to maternal mortality. Hypertension or high blood pressure affects approximately 1 in 10 pregnancies in the United States and is one of the leading causes of maternal, neonatal, and fetal maternal morbidity and mortality. When left uncontrolled, hypertension can result in complications, again, including preeclampsia and other things. This is where blood pressure cuffs come into play. These seemingly simple devices play a vital role in the early detection and management of hypertension in pregnant women. By regularly monitoring blood pressure levels throughout pregnancy and during labor, healthcare providers can identify potential complications early on and take proactive measures to safeguard the health of both of our mothers and our children. And with that, I would love to ask for our committee members to vote yes on this legislation because, again, this is an issue that helps tackle our issues around maternal mortality. Thank you.
Thank you. Representative Scott would like to comment. He is joining us virtually.
Thank you, Chairwoman Kim, and thank you to the maker of the bill as well. Thank you to Chairwoman Morgan Cephas, the tri-chair of the Black Maternal Health Caucus. This is an incredibly important matter that has affected not only members of my district, but also my personal family, who had a relative who recently gave birth, and had it not been for the advocacy around and the intuitiveness of her doctors, could have almost lost her life with respect to this. And this legislation will actually cure the gap in making sure that not only that folks have access to this care, but the education and awareness that it comes with providers informing them about this, and then also the patients learning about this bill. So I want to thank the committee, but thank the makers of the bill as well, the Black Maternal Health Caucus, for bringing awareness to this issue. And hopefully this is legislation that as soon as it gets to the governor's desk, will start saving lives immediately. I would urge a yes vote.
Thank you, Representative Scott. Any other discussion? Are there any negative votes on the bill? Alia, please take the roll.
Chair Kim,
Yes.
Abney, Brennan, Cephas, Gergely,
Yes. Designation yes.
Haddock,
Designation yes.
Kozarowski,
Designation yes.
Malagari, Mirsky, Monroe,
Designation yes.
Parker, Scott,
Designation yes.
Venkat, Warren,
Designation yes.
Chair Pickett,
Yes.
Fink, Fritz, Kutz, Ledbetter, Mahalik,
Designation yes.
Miller, Nelson, Rader,
Designation yes.
Rowe, Zimmerman. You're fine.
The bill passes by a vote of 24-1. All right, the next order of business is consideration of Senate Bill 943. Is there a second? Representative Malagari. Alan, please explain the bill.
Senate Bill 943 updates the 2018 Travel Insurance Modernization Act by further providing for definitions, providing for further disclosures to consumers, clarifying whether the policy provides primary or secondary coverage, providing further detail if pre-existing conditions can apply, and not allowing insurers to use an opt-out provision. It's an NAIC end-to-end coil model bill.
Thank you. There are no amendments to this bill. Madam Chair, any comments?
No, no questions or comments. I do ask for an affirmative vote. Thank you.
Thank you. Is there any discussion of the bill? Are there any negative votes on the bill? Hearing none. 1 second. All right, I'm hearing that we need a second. Malagari seconds Senate Bill 943. Sorry about that. Hearing none, no discussion. Senate Bill 943 is reported from the House Insurance Committee unanimously. All right, the last order of business is consideration of House Bill 2234. Is there a second? Representative Venkat, thank you. The proposal builds upon the bipartisan work of the General Assembly in creating Penny and the reinsurance program. Penny is where Pennsylvanians go to buy health insurance for themselves and their families. Penny and the reinsurance program have been very successful. In this past enrollment period, a record of 435,000 Pennsylvanians bought their health insurance through Penny. But many Pennsylvanians, especially those coming off Medicaid, cannot afford a Penny plan. Many other Pennsylvanians technically have coverage through Penny, but that coverage has a deductible in the thousands of dollars, meaning that person basically can't use their insurance. Let me give you an example of who this bill can help. Christine is a working mom who went into Penny to buy health insurance, but her policy has a $9,000 deductible and a 40% cost sharing. With that high cost sharing, Christine basically cannot use her health insurance for anything other than preventive and emergency care, and it still costs her $400 a month. People like Christine live in all of our districts, and they shouldn't be denied health care because they can't afford it. The bill before us has two goals in mind. More people get insurance, and more people get better insurance. The bill gives Penny the flexibility to explore creative ways to mitigate high costs and deductibles for about 200,000 Penny customers. And because the bill preserves the reinsurance program, the bill can reduce costs for the 500,000 Pennsylvanians in the individual market. Finally, 56 organizations support this bill. Alan, please explain the bill.
House Bill 2234 amends Title 40 insurance to allow Penny, the Pennsylvania State Health Insurance Exchange, to create a program providing state subsidies to assist Pennsylvanians in purchasing health insurance. This legislation would only allow Penny to create an affordability pilot program for 2025, and the program could only be implemented if the insurance commissioner determines that alternative funds are identified in the budget process to fund reinsurance. If funds are not identified, then the program cannot be implemented, and user fees can only be used for reinsurance. The legislation does not provide for an appropriation, and we expect the funding source to be debated as part of the budget process.
There is one amendment to the bill. I offer Amendment A04257. This amendment would require the insurance commissioner to reapply for a federal waiver to implement the reinsurance program. Reinsurance is important because it helps to suppress premium increases. The reinsurance program was created in a unanimous bipartisan fashion back in 2019. This amendment requires the insurance commissioner to reapply for waivers necessary to continue with the reinsurance plan. Is there a second to A04257? Representative Brennan, any comments? Madam Chair.
And I thank you, Madam Chair. Reinsurance was a pivotal part of getting Act 42 passed in a bipartisan manner. It is a successful program that has a positive impact to consumers both on and off the exchange. I do understand the intent behind the amendment. However, I have heard loud and clear that stakeholders do not want disruption to the reinsurance program. It is for that reason that I will be voting no, and I do ask my colleagues to do the same. Thank you.
Thank you. Is there any discussion on the amendment? Are there any negative votes on the amendment? Alia, please take the roll.
Chair Kim,
Yes.
Abney, Brennan, Cephas,
Designation, yes.
Gergley,
Designation, yes.
Haddock,
Designation, yes.
Kozarowski,
Designation, yes.
Malagari, Mirsky, Monroe,
Designation, yes.
Parker, Scott,
Designation, yes.
Venkat, Warren,
Designation, yes.
Chair Pickett,
No.
Fink, Fritz, Ledbetter, Mahalik,
Designation, no.
Miller, Nelson, Rader,
Designation, no.
Rowe, Zimmerman.
Madam Chair, I believe I was excluded from the roll call.
Oh, we're sorry about that.
No problem?
Kutz,
No. Thank you.
Thank you. So the amendment passes 14-11. Thank you, Alia. I move to report House Bill 2234 as committed. Is there a second? Representative Parker, any comments, Madam Chair?
And I thank you again, Madam Chair. I am for consumers. Whenever I cast a vote, I have their interests in mind. That frame of reference is no different when I look at House Bill 2234. The premise is to give consumers a state subsidy on top of their federal subsidy, which lowers premiums on Penny. It does sound like a pro-consumer proposal, but there is a catch. To receive the added benefit, the General Assembly must first agree to redistribute funds from an unnamed account and transfer it to the reinsurance program. Now, if those stars align, consumers would only be guaranteed the additional premium reduction for 1 year. It is unclear how much the program will cost. It is unclear how many will benefit. It is unclear how many will upgrade to a better plan, and it is unclear how much lower premiums will actually be. It is unclear what will happen after 2025. As elected officials, we have a responsibility to understand what we are voting on and how it will help our constituents. I don't think it is appropriate to go back home to talk about unrealistic expectations. That doesn't help our consumers or give them hope. Therefore, I will be a no and ask my colleagues for a negative vote. Thank you.
Thank you, Madam Chair. Madam Chair, I'd just like to respond to some of your comments. Some folks have asked, why are we doing this now if we are missing some information that could help make people feel more comfortable moving this bill forward? I made the decision to do this now because we need to start this process and we need to get the ball rolling. From my understanding, Penny will have a pretty major meeting on May 16th. The board will decide on a couple of models that will help identify the maximum number in terms of identifying the folks with the highest cost barriers and to which one of those will benefit from this program. We also have learned that Penny has a technology vendor called Get Insured, and they need time for the coding process for this program if we want to implement it. This usually takes about 3 to 5 months to get the coding for new programs up and running. And if we wait on this bill too long, they may not be able to get the program up and running in time for the open enrollment of 2025. As you know, there is a budget process coming up in the next month, and we're going to be having deliberations, and we hope that we will identify some funding for this important program, which is, again, a pilot for the year 2025. I believe we will have more answers in the coming months, but again, we need to get this ball rolling. Penny cannot snap their fingers and make this work in a short amount of time. And I also want to reassure everyone, if we cannot find the additional funding, this program will not work. If we do not fully fund reinsurance, this program will not move forward. So I would like to have us on the record that we are putting out a pilot program that will help hundreds of thousands of folks to get insurance or get better insurance. With that, I ask if there's any other discussion on this bill. All right, Alia, please take the roll.
Chair Kim,
Yes.
Abney, Brennan, Cephas,
Designation, yes.
Gergley,
Designation, yes.
Haddock,
Designation, yes.
Kozarowski,
Designation, yes.
Malagari, Mirsky, Monroe,
Designation, yes.
Parker, Scott,
Designation, yes.
Venkat, Warren,
Designation, yes.
Chair Pickett,
No.
Fink, Fritz, Kutz, Ledbetter, Mahalik,
Designation, no.
Miller, Nelson, Rader,
Designation, no.
Rowe, Zimmerman.
Thank you, Alia. The bill passes by a 14-1 vote. 14-11, excuse me, thank you. There being no further business, the meeting is adjourned. Thank you so much, everyone. Have a great day.